Good morning, everyone. Welcome to our weekly media briefing for COVID-19. I'm Kerri Schuette, the spokesperson for the Shasta County Health and Human Services Agency. We will start, like we always do, with the numbers. As of August 10th, we have had 469 confirmed cases, including 10 from Monday. We have done a total of 26,167 negative tests for a total of 26,636 total tests. We have 37 people in isolation, 283 on quarantine. Once again, the difference is the people on isolation have tested positive and people on quarantine have been identified as close contacts with people who have tested. We have 39 active cases, 420 released from isolation to date, and 10 deaths. Right now, we have 2 people hospitalized in Shasta County, and both are in the intensive care unit. And this report should include the rest of the tests that were backlogged after the problem that we mentioned last week with the state database. And our investigation team is working to confirm how many positives were included in this backlog. We know we saw probably at least a couple thousand negative tests come through, but it looks like we have fewer than 10, probably far fewer than 10 positives that were part of that backlog. So that's great news for us. Here with us today, we have County CEO Matt Pontes, HHSA Director Donnell Ewert, and Shasta County Health Officer Dr. Karen Ramstrom. From our hospitals, we have Mark Mitchelson from Shasta Regional Medical Center, Robert Folden from Mercy Medical Center, and Jennifer Andrea from Mountain Valleys Health Center. Val Lakey from the Intermountain area is not able to join us today. Does anybody have anything they would like to start out by sharing before we go to media questions?
Morning, everybody. So I just thought I would just quickly review what is closed right now. I think it's hard to, for the public to keep track. Sometimes it's hard for us to keep track. So I thought it would be worth just kind of running down that list about what is closed in our county right now. We are not on the county monitoring list, and we're monitoring those indicators that could potentially put us on the list very closely, and don't have concerns about approaching those thresholds at this point. So that's very good, and we appreciate everybody's participation and prevention measures to mitigate and prevent us from getting on that list. So I just wanted to read off the short list of what is currently closed in Shasta County based on state requirements. And that includes bars, public events and gatherings, convention centers, theme parks and festivals, indoor playgrounds, saunas and steam rooms, and competitive sports, except for professional. And there's some new youth sports guidance out that we can talk about today if need be. And then in addition to that, closed to indoor service includes restaurants and wineries, movie theaters, family entertainment, museums, galleries, zoos, and aquariums, and card rooms. And again, when it's appropriate, those entities can be open to outdoor services. And I think that's all I had today, but happy to answer questions.
Thank you, Dr. Ramstrom. Anything anybody else would like to add? Okay, we're ready for media questions.
So, Kerri, sorry, real quick. One thing that I just emailed you about and I completely forgot to mention. So institutes of higher education are able to open to in-person instruction if local data indicates that that can be done safely. And so in Shasta County, that is a possibility for consideration for our institutes of higher education.
Yes, thank you for that clarification. And Tim Mapes is working to update that on the website right now. Our staff worked very closely with Simpson University to help them work through all of those logistics so they could open in person. Okay, media questions.
So Dr. Ramstrom, tell us about youth sports. What's changed or what's open or what's going on there?
Yeah, and I think that may have come out, we might have talked about it last time, I can't recall. So it's the same as what we had heard previously in terms of sports have to involve physical distancing, at least 6 feet, and preferably outdoors, and competitions, tournaments are not allowed. particularly in the interest of preventing mixing, even within a county. But individual activities that can be done with distancing are allowed, and it's recommended for activities that are done indoors that those be limited to those that don't involve a lot of exertion, because masks are required for indoor activities. And so if there are activities that involve heavy exertion, then those should be done outside.
Thank you. Could you quantify kind of where we are as a county in relation to being on the monitoring list or not being on the monitoring list?
I don't have it right in front of me. I can tell you. So for the measures, there's a number of them. So the state's database is not current. They're catching up in terms of the case rate and case positivity rate. So we're looking good in terms of where those are compared to the benchmarks of our own monitoring of those. We don't have concerns. And our hospitalization information is also, that is current on the state website, because that's a different data source. That's something that we get separately from this data system that had issues last week. And so we're confident with that data, and those also are looking good. Our hospitals data has been looking less impacted this week. And so that includes both hospitalizations. ICU always is sort of in the middle road, and that's, you know, in part because there's other people have other issues, you know, that they're in the intensive care unit for. So, and that's based on just standard, not taking into account our surge capacity.
And finally, could you kind of talk about what you went through with Simpson University to get them to the point where they can open?
Sure. You know, so they've been actively working to have a plan since the spring, and we've had a staff person who's been working with them closely over the last few weeks. And then when the state guidance came out, they are in the process right now of comparing what they've come up with what the state guidance indicate is required. And they feel pretty confident that they're meeting all their benchmarks, but they're doing a double check. But staff have gone out, they've looked at the dorms, they've walked through the campus to give feedback on what the plans are. And so the Simpson has done a lot of work to ensure that they're prepared. There's a few little follow-up items that we're going to be just in contact with them about. The one thing that we did talk about is that as they're having in-person instruction, that we want to just stay in close communication. And certainly we'd be there to support, and they need to have a plan if they were to have a student or a faculty test positive. We talked through what that would look like. And they've been doing that planning. Yeah, we'll be continuing to have conversations with them, and certainly, you know, moving into the fall or winter, if our numbers, you know, became concerning, that we would be checking in on a regular basis so that we would have plans in place. They also have augmented their capacity for distance learning, and so, you know, I think that they can move in that direction if that was necessary. But you know, they actually have a pretty rigorous plans in place to be able to implement the state requirements based on our conversations yesterday.
Thank you, Doctor.
Other media questions?
Can you guys hear me? Oh, hang on.
Go ahead, Elena.
Okay, thanks, Steve. So I was just wondering, I don't know, maybe it just stands out to me, but it seems like we had quite a few cases over the weekend, and obviously, I mean, on the individual days, not just when you introduce them as a grand total on Monday or Tuesday. Is that something you guys, you know, also feel like there was a significant increase? And if so, what might be behind that?
You know, looking at our trends over time, you know, kind of on a weekly basis, that wasn't concerning, the numbers that we saw over the weekend. It was pretty on par with what we've been working with. And it may be because, you know, sometimes we see things come in late in the day and then they get kind of the next day. And so we kind of see that on a daily basis. And we've had a little bit of ups and downs, but it doesn't seem to be out of the ordinary.
Okay, thank you. And then I was also just curious for your, however many of you, your reaction to that, I guess, rally last night at the Board of Supervisors. I think I heard they've been there before, but last night was kind of a new level of people complaining about the various COVID guidelines.
Well, I can share my impressions, but I would love it if Donnell and Matt would weigh in too. Go ahead, Donnell.
The Board of Supervisors was being responsive to the community by holding an evening meeting so that community members could come and voice their points of view. And it was a very robust expression of some of the frustration and hardship that people have been experiencing as a result of COVID. I think that's all valid and, worth taking in. I think we all benefit from hearing the stories of things that people are experiencing. The board was really taking time to do that. It took about 3.5 or 4 hours to have all the people speak that wanted to. So I think that was productive time. And then obviously we were able to brief the board on the latest situation from our point of view as well. I'm not sure it was a protest. Maybe it was. I think it was more of a rally. We obviously, believe strongly that people have a right to do that. That's allowed in the guidelines to have protests outside. We obviously would prefer people wear masks and social distance, and that wasn't necessarily happening. As far as my observation, but as far as is their right to do so, and that being allowed by the guidance, that it definitely was. So I guess that's my point of view. Maybe Matt wants to say more.
Hey, this is Matt. Thanks for the question. I think for us, it's always good to hear from your community on how things are going, and we know that the COVID is affected all of our lives, personally and professionally, and it is a very difficult thing that we're all trying to figure out. I think that tensions are high out there, and the board listened to the community and really wanted to have this evening meeting to hopefully allow a lot more folks to come and tell us what their challenges are and share with us some of their frustrations or some of their successes. And I think the board was able to do that last night. So I'm glad we had the meeting. And I think that, as Donnell said, the story is really beneficial to as we move forward, how we communicate back with the state on how Shasta's doing up here. It's all really important. We have public meetings just about every Tuesday across the year, and it was great to see a lot of people turn out, and it was great to see the kids also be a part of that conversation, letting us know from their perspectives how they're doing. And I just say that we're open just about every Tuesday, 9 a.m., and we are now accepting other ways to communicate to the board through email and through phone calls if folks can't come down. And we're anxious to keep hearing how the community is doing. And we know that we took a lot of notes last night, and that we're going to be trying to get some information out there that helps people understand the situation. And certainly are thinking about a lot of the things said last night.
All right, thank you, Matt.
I do also want to just reiterate that, a lot of the folks were saying that they want Shasta County to be open. And I just want to make sure again that we repeat that our local health officer has not made any restrictions over and above what the state of California has imposed on the state. We are as open as we can be, and we are not on the state monitoring list due to the strong disease containment efforts of Dr. Ramstrom and the team that's in the Department Operations Center. And we are doing all that we can to keep the county as open as possible. We all want that. So we are one of roughly 20 counties that still are not on the monitoring list, and we have a lot more businesses open as a result. Also, because of that, our faith communities are still able to meet. There are a number of restrictions for inside meetings. There are not a number of restrictions for outdoor meetings for faith communities. and our schools are able to open, and each school board is making that decision on their own as to what model they want to go with. You know, some are open 5 days a week, some have a hybrid schedule, and some are doing distance learning. Those decisions are not made by the Board of Supervisors, and they're not made by the County Office of Education. They're made by each individual district and their school boards. But the fact that they even have those options is because we are not on the state monitoring list. So Shasta County is open. It is again in the category of most open of all counties in California.
Thank you, Donnell. Other media questions?
Dr. Ramstrom, the belief that children are much less susceptible to contracting COVID than adults, is that based on just raw numbers and that few of them have shown positive results, or is there some other science behind that? I mean, in other words, is it possible that they've just been more isolated than the adult population, in which case might we see a big surge now that a lot of them are back together again?
Right, you know, I suspect it's a combination of couple things. So one, we do know just physiologically that younger children in particular are not as vulnerable because they don't have a certain receptor that the virus has an affinity for to actually get cause infection and start infection in an individual. So that's in part why younger children are seem to be less prone to infection. And then in addition, like you'd mentioned, you know, if children haven't been out and around others, then they're less outside of their households, then they have been less likely to be exposed. And so that is likely contributing. So I think it is yet to be determined. We're hopeful that, you know, as school starts in person and the schools that choose to do so, that the prevention measures in place are going to mitigate any additional risk. There's other considerations too, like children, especially little ones have, you know, especially if they're not symptomatic, they're just not going to be able to transmit as much just based on their size and those kinds of things. So I think it's a combination of both behaviors and what we've been doing as well as physiology. But, you know, yet to be determined what's going to happen in the real world. And so I think we're all anxiously waiting to see how things play out.
Okay, thanks.
Other questions from the media? Okay, I was sent one question from the public about whether parks are open and if Big League Dreams can open. Parks in open spaces are allowed to open, though if you're going to a state or a national park, you should probably check their website. In some cases, those organizations have closed certain facilities for a variety of reasons. Of course, the social distancing, the 6 feet of physical distancing between household members would still be in effect at parks. So okay to go with your family to have a picnic somewhere. Big League Dreams, competitions are not allowed, but practices are if they are following the athletic practice guidelines. That is allowable. Restaurants would be allowable under I know they have a snack bar, and so that would be following the restaurant guidance. So outdoor dining would be required. I don't know if Big League Dreams actually is open, but those are the things that would be allowable at Big League Dreams. Does anybody have anything to add about that? Okay. All right. Any other questions? All right. Seeing none. I think some of us had a long night last night, so we will bid you all farewell for one more week, and we'll see you again on Wednesday at 11 a.m. Have a great day, everyone.